Embracing imperfection and stress as the foundation for growth, excellence, and well-being in dentistry. Authored by John William Claytor, Jr. Studies reveal that stress in dentistry begins early in training and may progress throughout a dentist's career. Fear of managing patient dissatisfaction, demanding schedules, time constraints, staff issues, and the stressors of clinical dentistry all contribute to professional strain. Difficulties associated with perfectionistic tendencies, burnout, and mental health concerns remain ever-present challenges within the profession. This article discusses evidence-based strategies, coping skills, organizational approaches, and professional resources that may help mitigate the effects of stress in dentistry. Particular emphasis is placed on reducing stigma surrounding mental health care and supporting initiatives such as the Lorna Breen Heroes Foundation's Safe Haven efforts, which encourage confidential access to mental health support without fear of punitive professional consequences. Introduction. Stress in dentistry is ubiquitous and begins early in professional training. The ability to recognize stressors and respond appropriately is critical to preventing burnout and preserving long-term well-being. Dentistry combines demanding clinical responsibilities with high patient expectations, financial pressures, interpersonal challenges, and regulatory oversight. These realities can contribute to anxiety, emotional exhaustion, and psychological distress throughout a dentist's career. This article examines the origins of stress in dentistry, the role of perfectionism and personality traits in professional well-being, and evidence-based strategies to help dentists cultivate resilience, foster healthier work environments, and achieve sustainable professional fulfillment. Stress in dentistry, from training to practice. Research has demonstrated that stress in dentistry often begins during dental school. More than 35 years ago, Lloyd and Musser investigated psychiatric symptomatology among dental students and found significantly higher levels of obsessive-compulsive tendencies, interpersonal sensitivity, anxiety, and depressive symptomatology compared with the general population. Dental students were also found to exhibit symptom patterns similar to medical students and greater psychiatric symptomatology than general medical patients who were considered psychiatrically healthy. 1. The study further suggested that excessive performance demands and perceived stress may contribute to cognitive inefficiencies such as indecisiveness, blocking, memory impairment, and hypersensitivity to evaluative judgment. These findings align closely with personality characteristics frequently associated with dentistry, including competitiveness, conscientiousness, perfectionism, and achievement orientation. Subsequent research has reinforced these concerns. In a study of 2,053 dentists in the United Kingdom, 54.9% reported currently experiencing high job stress, with general dentists reporting the highest levels. Common stressors included threats of complaints or litigation, dissatisfied patients, pressure to meet financial targets, running behind schedule, and managing difficult patient interactions. Dentists in the study also demonstrated higher levels of suicidal ideation compared with the general population, underscoring the psychological burden associated with fear of litigation and regulatory oversight. More recent findings from the American Dental Association, ADA Council on Communications Trend Report 2024 revealed that 82% of surveyed U.S. dentists reported experiencing major stress in their careers. In the 6 months prior to taking the survey, many dentists reported feeling defeated, wanting to quit dentistry, or not wanting to go to work. Approximately 58% were considering career changes or early retirement due to stressors such as workforce shortages, patient attitudes, clinical demands, and insurance reimbursement concerns. 3. The evolving structure of the dental workforce may also influence professional stress. According to the ADA Health Policy Institute's 2025 report, the U.S. dental workforce is becoming younger, more female, and more racially and ethnically diverse. Younger dentists are increasingly entering group practices and dental service organizations, DSOs, while delaying practice ownership. At the same time, workforce shortages in rural areas and increasing operational complexity continue to create new pressures for practicing dentists. Dentists routinely encounter stressful professional conditions. The ADA's Dentist Well-Being Survey Report 2021 states that most dentists experience significant work-related stress, and dentists under 40 years old are more likely to score higher on the depression risk assessment questions than older dentists. Research by Rada and Johnson-Leong demonstrated strong associations between chronic workplace stressors and anxiety disorders, depression, burnout, sleep disorders, memory problems, and substance use disorders. Additional studies have found that between 82% and 86% of dentists experience moderate to severe stress in practice. Collectively, these findings demonstrate that stress in dentistry is not an isolated issue, but a profession-wide concern that begins early and may persist throughout a clinician's career. Understanding the psychological contributors to burnout. Perfectionism and the pursuit of excellence. Perfectionism is deeply embedded within dental culture and professional identity. However, perfectionism exists along a spectrum and may either support professional growth or contribute to burnout. Perfectionistic concerns represent the maladaptive side of perfectionism. Dentists exhibiting these tendencies often establish unrealistic goals, equate mistakes with personal failure, and believe they must perform flawlessly in every circumstance. This mindset may manifest clinically through excessive self-criticism, fear of failure, procrastination, indecisiveness, and emotional exhaustion. When clinical outcomes are less than ideal, these individuals may catastrophize setbacks and interpret imperfection as evidence of inadequacy. Mistakes should not be seen as reflecting unworthiness or not being good enough, but as a testament to the practitioner's humanity. In contrast, perfectionistic strivings can reflect a healthier orientation toward excellence. Dentists with this perspective pursue high standards while recognizing that dentistry is a lifelong learning process. They remain teachable, recover more quickly from setbacks, and use adverse outcomes as opportunities for growth rather than evidence of failure. Their actions are motivating and marked by good coping skills. The distinction between perfection and excellence is critical. Excellence reflects a commitment to continual improvement, humility, and responsible patient care. Perfection, however, is unattainable and may become psychologically destructive when viewed as the required standard of professional worth. No one is perfect. The goal in healthcare should reflect a standard of excellence in care and a continuous evaluation process to improve care through education. Accepting human imperfection while striving for clinical excellence may help reduce burnout and improve emotional resilience. Personality traits and practice fit. Understanding personality traits may also provide insight into stress management and career satisfaction. The Big 5 personality traits model suggests that personality characteristics influence how individuals process stress, communicate, lead teams, and adapt to workplace demands. Dentists who are highly reactive, easily agitated, or emotionally volatile may struggle in high-pressure practice environments that require constant multitasking, staff management, and emotionally demanding patient interactions. Recognizing one's personality tendencies may help determine the most appropriate practice model, leadership style, and work environment. Leadership and workplace culture. Workplace culture significantly affects professional well-being. Christina Maslach identified 6 workplace areas strongly associated with burnout: workload, control, rewards, community, fairness, and values. When mismatches occur in these domains, burnout risk increases substantially. The negative impact of workplace mismatch creates an employee experience of crushing exhaustion, feelings of cynicism and alienation, and a sense of ineffectiveness. The triad known as burnout. Burnout syndrome occurs when people experience combined crises across all 3 dimensions, most of the time. Burnout is therefore not solely an individual failing or the result of inadequate self-care. Organizational structure, staffing inefficiencies, poor communication, lack of autonomy, and unhealthy workplace dynamics may all contribute to emotional exhaustion. Conducting an office efficiency inventory to evaluate scheduling systems, delegation patterns, staffing structures, and workplace culture may help identify areas contributing to chronic stress. Leadership style also plays a critical role in practice satisfaction. Dentists who cultivate trust, encourage collaboration, and delegate effectively often foster healthier workplace environments. Leaders who promote creativity, accountability, and team engagement may reduce workplace stress while improving morale and operational efficiency. Strategies for resilience and well-being. Building professional and personal support systems. Isolation is a major contributor to burnout. Developing meaningful professional and personal relationships can provide emotional support, accountability, and practical guidance. Mentors can offer clinical insight and perspective during difficult professional situations. Collegial relationships may provide both professional collaboration and emotional support, helping dentists move away from a culture of competition toward one of mutual encouragement. Accountability partners and trusted friends outside dentistry can also provide honest feedback and emotional grounding during periods of stress. These relationships often allow discussions about personal struggles in a safe and supportive environment. Financial stress remains another major contributor to burnout. The average U.S. dental school debt was reported at $297,800 in 2025. Educational debt combined with practice acquisition costs may create significant financial pressure early in a career. Working with a trusted financial advisor to establish a debt reduction plan may help reduce long-term stress and improve career flexibility. Dentists must also remain engaged in the business aspects of practice. Understanding operational systems, financial performance, and long-term planning allows practitioners to work on the business rather than only in it. This perspective supports intentional decision-making and may reduce uncertainty-related stress. Continuing education beyond clinical skills. Dental education heavily emphasizes clinical science and technical skill development. However, comparatively little time is devoted to interpersonal communication, conflict resolution, motivational interviewing, emotional regulation, or boundary setting. Continuing education focused on people skills may help dentists better navigate challenging interactions with patients, staff, and colleagues. Improving communication skills and learning strategies for decatastrophizing stressful situations may strengthen emotional resilience and reduce interpersonal strain within practice settings. Human connection, reflection, and mental health resources. Human connection remains essential for well-being. Mindfulness practices such as prayer, meditation, gratitude, reflection, and forgiveness may contribute to emotional balance and resilience. Maintaining supportive relationships and regularly engaging in self-reflection may help practitioners recognize stress before it becomes overwhelming. Several mental health resources are now available specifically for healthcare professionals. The Mayo Well-Being Index allows clinicians to monitor their mental health status regularly, while online platforms such as Talkspace and BetterHelp provide accessible educational and counseling resources. Traditional professional counseling and therapy may also provide valuable support for dentists experiencing stress, anxiety, depression, or burnout. Reducing stigma and supporting professional well-being. A major barrier preventing healthcare professionals from seeking mental health care has historically been the fear of professional repercussions. Concerns about licensure, credentialing, and stigma may discourage dentists from pursuing treatment when needed. The Lorna Breen Heroes Foundation has advocated for safe haven provisions that encourage healthcare professionals to seek confidential support without fear of punitive licensing consequences. These initiatives aim to remove stigmatizing language from licensing applications and create pathways for dentists to obtain help safely and confidentially. Reducing stigma surrounding mental health is essential to the future well-being of the profession. Recovery and resilience are strengthened through openness, vulnerability, professional support, and meaningful human connection. Conclusion. Stress, burnout, perfectionism, and mental health concerns are deeply intertwined within the profession of dentistry and often begin early in training. Research demonstrates that these challenges may persist throughout a dentist's career unless proactive strategies are implemented to support well-being. Addressing burnout requires both individual and organizational approaches. Developing healthier perspectives on perfectionism, understanding personality traits, improving leadership and workplace culture, strengthening support systems, engaging in continuing education, and utilizing mental health resources may all contribute to greater professional fulfillment and resilience. The profession must also continue reducing stigma associated with seeking mental health support. Initiatives such as the Lorna Breen Heroes Foundation's Safe Haven efforts represent important steps toward creating a culture in which dentists can access care without fear of punitive consequences. Ultimately, sustainable well-being in dentistry depends on recognizing that excellence does not require perfection. Through intentional self-awareness, meaningful relationships, healthy workplace systems, and ongoing personal growth, dentists may cultivate healthier and more fulfilling professional lives.